Good afternoon, and thank you all for being here. This is going to be an attempt at some educated guesses about the future. My one hope standing before you is that the right set of slides will appear when I hit the clicker. There was the first set that were pre-President-elect Trump. Then there was the second set that was pre-Secretary-designee Price. And then there's this set of slides, which we'll see. As the names and the slides have changed, one of the things that has occurred to me is that great Chinese curse, may you live in interesting times. I think from the point of view of healthcare, it's going to be very interesting. And I hope that none of you remember my talk today, because I don't know that any of the things I will tell you are actually going to happen. However, we're going to talk about three things quickly, and then there'll be a big finish. First, what I see as healthcare's most persistent challenge, which is healthcare cost. Then second, I'll have a few slides from the original presentation, which was to talk about how the healthcare exchanges under the Affordable Care Act have functioned, and particularly what has happened in the West versus the rest of the country. And finally, as I said, some hopefully educated guesses about the future of healthcare reform under Trump. And you're supposed to tell them what you're going to tell them, then tell them what you told them. What I'm going to tell you is nobody really knows what Mr. Trump thinks, but the people he selected have extremely deep and detailed views of what ought to happen in healthcare. I mean, extremely deep and detailed. Chairman Price has a bill, HB 2300, which goes into extreme detail, legislative language ready to go, and it would change American healthcare overnight. Whether that's going to happen or not is another issue. And then, of course, as I said, there'll be a big finish. Okay. I'm about to show you a slide that I consider the equivalent of a master's degree in health policy. But I'm a little embarrassed because the Dean of Healthcare Policy Research is here today, Victor Fuchs, a professor here at Stanford. So Victor, don't hold this against me. Every healthcare system in the world tries to do three things. First, to provide high quality care, make it, secondly, accessible to all, and third, at an affordable cost. That's the goal of every healthcare system. And the question, of course, is how have they done? You can enroll at Stanford and get a master's degree to find that out, or you can remember the following story, okay, which explains how we're doing. For a minute, we're going to shift from healthcare, we're going to go to the movies. And the movie we're going to is called Diner. It's about 25 years ago. It was a great movie about four friends and their female friends in Baltimore, and they used to meet at a diner. One of the characters was named Boogie, and it turns out that Boogie is a real person. It further turns out that he has a diner in Aspen, Colorado. And it's a room actually like this, the ceiling is about twice as high. On the far wall, there's a huge sign. It says, "Our food is fast, good, and cheap." Now, if you walk up to the sign, you'll notice at the very bottom, in very small letters, it says, "Pick 2." That's how most healthcare systems have done. What's embarrassing is in the United States, we barely made one. We used to believe that the United States had the highest quality healthcare in the world, and it was very expensive. But that was okay, because we believe in market economies. And in the market, if you have something that has high value, it's going to be expensive. Now, something that's very expensive means there's going to be limited access. But this is America, and if you can't afford good health care, it's your own fault. You ought to be out there working and be able to do it. Or maybe you don't want good health care. Perfectly okay. That's what we believe. What we now know is the United States has grotesquely uneven health care quality. I assume most of you are close enough or have vehicles that can get you to the Stanford hospital if you need hospitalization, and the best you could possibly imagine in terms of quality care. Also, one of the singly most expensive hospitals in the universe. I'll just say that in passing. But as healthcare cost writ large has grown, and as wages and frankly the entire GDP not kept up, we've seen access actually decline until the Affordable Care Act was passed. I have some statistics about quality of care, but I think I better keep going. There may be some of you who are associated with care delivering organizations, but just in passing, let me say that medical errors are the third greatest cause of death in the United States. Medical errors, okay? And 1/2 of Americans do not get evidence-based care. The first statistic comes from Johns Hopkins, the second from Rand. I don't make these up, I steal them from other people. Now, there has been some good news about the cost of care, or the rate of growth in the cost of care, but the bad news, it's over. According to CMS, the recent slowdown in healthcare costs is probably not going to continue. They estimate that between 2015 and 2025, healthcare spending will average about 5.8% in terms of annual growth, while the GDP will average about 4.5%. And so what we're seeing is healthcare growing well beyond growth in wages. This is due to increase in coverage, increase in prices, improvements in the economy. Actually, more people have more coverage, increases utilization. And the big thing that the world is facing is an aging population. The good news is the older you are, the older you are. The bad news is the older you are, the more healthcare resources you consume. So it's an almost Malthusian inevitability. Okay, so what's wrong with spending all this money on healthcare? It has impacts across our country and across our economy. The first thing is affordability for individuals. According to the Kaiser Family Foundation, for instance, in 2015, family premiums rose by about 4%, which is a good number historically, while wages went up by 2.2%. So healthcare costs are taking an increasing part of family budgets. It also becomes a big part of the GDP. We're now at about 17.5%. This is healthcare as a percent of GDP, and it crowds out other things. Now, you can argue that other things aren't as important, but as healthcare continues to grow, it continues to have an impact on the economy. A big issue, if we're here talking about public policy, is that the rate of growth in healthcare costs is a direct contributor to increasing the federal debt and increasing interest costs. And according to the CBO, total federal debt, which is now at about 76% of GDP, will be by 2040 equal to 100% of the GDP. In other words, we'll owe as much money as our entire economy is throwing off every year. I will come back to this at a later point, my big finish, because it creates not just a problem economically, it creates a problem for us in terms of national security. However, I will now make a joke, courtesy of Ben Bernanke, the former head of the Federal Reserve Board. When dealing with these issues, he opined that the United States is now the largest health insurance company on earth that also has an army. You might want to think about this, and if you take a look at the federal budget, the irony is we can afford the army. We can afford all the wars that are going on. What we can't afford is the federal costs of health care and the increasing costs associated with paying interest on the debt. However, now we're back to the original reason that I was invited, which is what's going on with the health exchanges across the country, and particularly what's happening in the West. I won't go through all of these things, but there have been a lot of problems associated with making the health exchanges work. This is the opportunity that people have to buy health insurance directly and to get subsidies from the federal government. It turned out that the risk pool, the people who signed up were sicker than was expected. Many insurers priced too low and are having problems as a result. Premiums are going up. Health insurance companies are backing out. And cost control is not popular with most Americans. I won't go through all of this in detail, but interesting to note is that according to a Kaiser poll that was in the newspaper today, only 1/4 of Americans want to repeal Obamacare. It's very interesting. This is actually very helpful. And the huge impact of Obamacare has not been the exchanges, it's been the increase in coverage in Medicaid. And let's take a quick look at what's going on the West Coast. While the state exchanges have had uneven success, and we'll talk about these three states, for instance, over 20 million people have gotten coverage as a result of this law, most of them through expanded Medicaid. And if you remember your master's degree in healthcare policy, access was real important, and we're doing a really lousy job. That's what Obamacare has done. It has dramatically increased access, mostly through Medicaid. California, if you look at this chart, has performed better than almost any other state, even though it started with the highest number of uninsured in the United States. 5 million people have become covered in California as a result of the law. About 1.4 million people bought health coverage on the exchanges, and about 3.7 million have been covered by expanded Medicaid. As you can see, the uninsured rate in California is now down to 8.6%, which is lower than the national rate, which is at 9.4%. If you take a look at Arizona, one of the things you see is, although they did expand Medicaid, and they did get a reduction in the uninsured rate, they have lost 6 out of the 8 insurers who were selling policies on their exchanges. Texas, which did not expand their Medicaid program, has, as does Arizona, prices going up fairly dramatically. They lost almost half of the insurance companies who were selling policies. They still have 10, and they have an uninsured rate of 17.1%. So the point of the story is California has done better than anybody else. I'll talk about that briefly in a minute or two. The thing has worked. If you say one of the goals was to increase access to health care. That is definitely true. The problem is, and we all have this in our minds, the other two things didn't move the needle. Hasn't done anything for quality, and you can make a pretty good case that it's probably increasing costs. So what's going to happen in the future? And you'll now see 3 slides that have been revised at least 26 times since the invitation. Mr. Trump has said many times that he supports repeal and replace, okay? Technically, very, very difficult to do, okay? They'll probably do amend and delay and use administrative mechanisms to change what's going on. It's going to take a while to do whatever it is they want to do, but this is what he said he wants. He also said more recently that he likes the elimination of pre-existing conditions and the notion of children being able to get health insurance through their parents' policies until they're 26. Okay? However, what's changed all the slides is that he has indicated that he wants Chairman Price, Tom Price, the chairman of the House Budget Committee, to be the next head of HHS. And I'll go through the politics of this in some detail. Mr. Price has an extremely detailed sense of what he wants, and it's in legislative form. That's dangerous. Most people talk big picture baloney. You got legislative language, you're ready to go, okay? And that gives you the basis to negotiate your way through. He's also very close to Speaker Ryan, who also has very, very detailed ideas about what he wants. The question, of course, is what they want, also what the president wants. And then the designee for CMS, Seema Verma, also has a track record, in fact, in Indiana, of reforming Medicaid. And my insight is going to be Medicaid is probably where you're going to see the biggest changes. So anyhow, they will use the budget reconciliation, they being Price and Ryan. The president will use executive orders, and it'll take about 2 years to do whatever it is they want to do. Hard to know exactly what they will be, but everybody in this list wants to give greater control to states. So that's probably going to happen, okay? Last year, Speaker Ryan put together a white paper called, oh, I'm sorry, this is this is Chairman Price. Excuse me. So this is what Price wants to do. This is HR 2300, and it is in legislative language, ready to go. It could be voted on in the House tomorrow. It repeals all of the mandates associated with the Affordable Care Act. And those of you who don't know insurance, the idea is if you mandate everybody to have insurance, then you come out okay in the end. That's the deal. If you don't, you let people choose. People who are sick will buy insurance. The people who are healthy won't, and you'll end up with very expensive insurance policies. Okay? He repeals all of that. He also repeals all of Medicaid expansion in his bill and doesn't replace either of those things with anything. So this would have a huge impact if this were law. And there are a bunch of other things that are in here. The use of health savings accounts, and Ms. Verma created in Indiana a requirement that if you're eligible for Medicaid, meaning you're very poor, you have to give money every month to a health savings, or you have to put money in a health savings account, and you have to pay your premiums every month, and if you don't, you lose Medicaid coverage for 6 months. Very different than what we have today. He's also in favor of high-risk pools. He caps tax exclusion. This is, we're now into the weeds, but this is not very popular with business. And he allows insurance companies to sell across state lines, which most people who are not involved in health insurance think is a good idea, which most health insurance companies, which can do it now, don't do. So you have a sense of how important that is. Price followed Ryan as chair. This is Ryan's stuff. He put together a white paper called A Better Way, and it includes, in addition to most of the things that are in Price's bill, it includes putting back in the pre-existing conditions protections, kids up to 26, and he wants to block grant Medicaid to states, okay? Now, we can talk about that later during Q&A, but this is a way to control costs, because you block grant this year what it costs this year, and then next year you raise the block grant by an amount less than the increase in actual costs, okay? That's how you save money if you're a Fed. If you're a governor, and there are a lot of Republican governors, you don't like that. So there's going to be a fight over that. And he also has privatizing Medicare with vouchers, okay? Very unpopular. Second rule of American politics, old people vote, poor people don't. So likely what's going to happen, Medicaid will change, Medicare not so much. And this is what the fights inside the Republican Party are going to look like. Yeah, we can discuss those after you've heard from other people. So what's the big finish? The big finish is none of the things I've talked about do much in terms of controlling costs. We still end up with the problem that we started out with. Policy changes and delivery system innovation will probably change things more than a full repeal, but you never know. Trump's choices for the healthcare post suggest a concerted effort to move to market-based healthcare. Again, one of the things I'd like to talk about during the Q&A session is market-based healthcare real? The U.S. is the only developed country on earth that has left healthcare in the market economy. We believe, in the ether somewhere, that the market economy is what's made us great, and we ought to stick with it. Query, does supply and demand, are consumers really able to function in healthcare as they are in other parts of the economy? That's the issue that you ought to think about. It ain't like buying a car, or maybe it is. So we need a new approach that combines evidence with voter and consumer attitudes. Now, here's the big finish. This failure to control cost is not just a healthcare issue and not just an economic issue, it's a national security issue. Ben Bernanke, who I quoted earlier, has said that healthcare costs are the single biggest threat to the American economy. He said that while he was at the Federal Reserve. He said it since. Interestingly enough, Secretary Gates, who was the former Secretary of Defense and apparently saw Mr. Trump yesterday, interestingly enough, has said that healthcare costs are the biggest threat to national security. Interesting thing to say for a Secretary of Defense. And the reason is that he harkens back to the Eisenhower years. Now, I don't know how many people were around then, but this is post-World War II, and the British and the French want more oil, and they think the Egyptians are kind of screwing them around with closing the Suez Canal. So they come to Eisenhower and they say, why don't we all just invade the Suez Canal, take it over, let all those oil tankers through? And Eisenhower allegedly says, that's not what Americans do. We don't invade other countries. We ain't going to do that. They go home. X number of weeks later, France and England invade the Suez Canal. What happens? Ike, former General Eisenhower, calls up his Secretary of State and he says, you call the Prime Minister of the United Kingdom and you ask him one question. This is post-World War II, early 50s. And the question is, who buys your debt? Answer, United States of America. And if you guys aren't out of the Suez Canal, we're going to stop and your economy will sink. They left. Those of you who are around will remember, they pulled out. Okay? Why is that relevant to a discussion of health care? Who buys the American debt? Roughly 50% of U.S. debt is bought by Americans. The rest is bought by non-Americans. Who are the three largest purchasers of America's debt? The Chinese, the Japanese, and the British, the UK banks, which generally accepted to be fronts for the Chinese and the Japanese. Okay? So the question is, if the Chinese and the Japanese get into a fight, and they want to know which side we're on, and by the way, they're in fights about lots of things right now, those little islands in the South China Sea and a bunch of other things, and they come to the President of the United States and they say, who buys your debt? Because we couldn't make it without the Chinese or the Japanese buying our debt. Anyhow, that's a little national security ending, and I hope we have some good questions and answers. Thank you.